Hey guys, so I wanted to come on and do a quick video. I usually like turn on lights and do all these aesthetic things to when I shoot a video, but I'm just like, you know what? I really like being in the dark. Like even when I'm at work, my 9 to 5, like I have all the lights off and I just have like my window open. So that's what I'm gonna do today, and hopefully you all can see me, but I don't have a lot of time because I have a client in exactly 11 minutes. But I wanted to come on and do a video because I have literally like been thinking about this topic all week, and I've been putting it off on doing a video. So I finally was like, I need to sit down and talk about this. And I'm not trying to be a snob when I say this, so please don't take it that way. But I was on Facebook, I think last week, or either this past weekend. I was on Facebook because today is Saturday. So the past weekend, so maybe like a week ago, I was on Facebook, and someone that I've gone on mission trips with before was posting their pictures of Jerusalem. They went like on a guided tour to Israel. And so they were like showing all of these pictures, and I think this is the name of it, but the Western Wall. So I went to Jerusalem or Israel in 2018, and y'all, and I said, I should know, y'all are gonna think I'm lying because I really don't really remember like the logistics and exactly like the origin behind the Western Wall and all that. And I'm like, I think that's what it was called. I don't even remember. But anyway, he was posting pictures of the Western Wall, and I was like, oh my God, like I remember when we went to that. And so the big thing about the wall is that you get like a pencil. I think they provided us with this, or maybe not. But anyway, like you take a pen and paper, like a small piece of paper, and you write down like a wish or something that you want to happen, and then you place it in the wall. And so the year that I went was 2018. And so I had graduated from nursing school in 2016, and December 2016, and I had started working as a nurse in Med-Surg 2017, and I had transitioned over to the CCU or the ICU in, I believe it was like, I think I stayed in Med-Surg for 7 months. So it was like July, August. I want to say maybe around that August time, 2017, when I went to the CCU or the ICU. And y'all, it was a really hard transition for me. There were some things that I caught on to really quickly and that I did really well in. And then it was some areas where I just was like, I questioned, like, am I going to be able to do this? I thought this was the move that I wanted to make, but was it the right move? Like maybe I should have just stayed where I was. And so it was a really hard transition, and not even just with the knowledge, because of course, like I think more is expected of you when you go to the ICU. The doctors expect more out of you. Your coworkers expect more out of you. Your supervisor expects more out of you. And so there are a lot of expectations, a lot of things that you have to learn quickly. And even you have to think about like the coworker aspect, because I've told you all in other videos that nurses really do eat their young. And when I first started, everybody was not the most pleasant. And so there were a lot of different things going on, and it was a really difficult transition. And so I remember when it was time to put my wish in the wall, and so we went January 2018. So I had been in the unit for a few months. The ICU, if I had started in August, and so to January. So I had been there for a little while, but still it was some days were harder than others. And like I said, it just was a transition. And so I remember my wish that I put into the wall was that I want to be known as a good nurse. And anybody that's gone to nursing school and has been a nurse knows what I mean by that, because people always like make little comments like, oh, so-and-so, they're a good nurse. And so I remember I put on my wish that I wanted to be known as the good nurse. I wanted to just have a reputation of knowing their stuff, of being that person that somebody was glad that they were working with, that just had the knowledge that that just was that well-rounded nurse that everyone loves, that that just knew her crap. And so I put that in the wall, and I want to tell you all something that happened for me. Like, I became that person, and not because I put it in a wall, but because I changed my mindset to become that person. And I really wanted to do this video to say that you have to understand, guys, that there's going to be a transition in nursing. Nursing school does not prepare you to be a nurse. Nursing school prepares you to pass the NCLEX. Once you pass the NCLEX and you get that RN is when the real work begins. And so there are going to be times where you look like an idiot. There are going to be times where you do idiotic things. I'm not saying you're an idiot. I'm just saying there are going to be times when you do things that you're just like, why did I do that? Like, what was I thinking? Or there are going to be times where somebody asks you something and you just simply don't know the answer. And I think that you just have to be patient with yourself and understand that, and just make it your mission, especially if this is what you want to do, and to just become better every day, to put your all into it. There were times where I had to get to work earlier because I knew that I needed to, that one of my weaknesses was, or maybe not even a weakness, but one of the things that I like to do was really get into the patient's chart and thoroughly look through all of the notes, look through their medications, look through their test results that they had, if they had any tests. Like, I knew that I needed to do that to just be better prepared. Because like I said, more is expected out of you, especially from a doctor standpoint. So I had to sacrifice and wake up earlier. Also, sometimes if it was things that I didn't know, like if something came up while I was at work and I kind of had to fumble through it, or, fake my way through it. Like, maybe when I got home that night, I would look it up and become more knowledgeable about it, because 9 times out of 10, you're going to see it again. So there were just little things that I did over time to become better. And even just and so that was from a knowledge standpoint, and even just from a bedside standpoint, like just being that nurse that was compassionate, being that nurse that was caring even when I didn't want to, giving a bath even when I didn't want to, giving an enema, doing extra things beyond even when I didn't want to. I remember I had a patient and he had brain cancer. Matter of fact, it just was so ironic how all of it came about. It was a new diagnosis. He had been a drinker for years, but a new diagnosis. He just recently found out he had brain cancer, and he just complained to me about being constipated. And so I literally, y'all, did everything. I mean, I did, because I had worked a 3 that week, so I had him every single day on my 3 shift that week. And y'all, when I say I went above and beyond I gave that man an enema. That man, I mean, I literally went above and beyond, and I did not want to give an enema. And literally, I still remember that enema to this day, because it was literally water everywhere. Like, it was so bad, y'all. But he felt better. He felt better, and he was so grateful, y'all. And he was so grateful that he nominated me for a Daisy Award, and which is like a big award in the hospitals that they give to a nurse that goes above and beyond. And I was a finalist and I ended up having my picture in the paper that that the hospital has, just because. And I didn't do, in the moment, I didn't do it for an award. I didn't do it because I wanted recognition. I did it because, one, I would want somebody to do that for me. If I was complaining about being constipated, I would want you to help me get relief, especially if I had a newly diagnosed brain cancer diagnosis. So it's just things like that, guys. Just know that you're not going to go from nursing school to the floor or wherever you're working and know everything and be the best ever to do it. Know that it takes time and it takes work to become the best, but you can do it. It's doable. And you should want to be the best, honestly. Like, you shouldn't want to be a subpar nurse. You shouldn't want to be the nurse that when they see your name and they see that they're going to, and other people see that they're going to be working with you, that they're like, oh, dang. Because there are people like that. There are people that I used to see, that I used to work with, and I would see their name on the board, and I'd be like, dang, ooh, it's going to be a long shift. So understand that. Be the best that you can be, not just when it comes to knowledge, but also when it comes to the care that you give to your patients, and also even when it comes to helping your fellow nurses. Like, don't be that nurse that, like I said, people don't like to work with you because you don't help them. You don't do anything. You're just so concerned about, you only look out for yourself. So, oh, and it was something else I was going to say, but I forgot, and I got this client in 1 minute. So I hope this helped. If I think of it, I'll try to come on and do another video. But you control your destiny. You control your destiny. It's you versus you. It's you versus you. Like, your mindset is everything. Like, if you want to be a good nurse and you do what it takes to be a good nurse, and you know, then you will be. And the opposite. So hope this helps, and I will see you all in the next video. Bye.